A very happy evening to all of yours. Welcome to this Garbha Sandesha's 25th episode. We are happy to be presenting the 25th episode of Garbha Sandesha. And the topic we are going to discuss today will be when is IUI recommended and what determines IUI success. And to talk about this, we have two senior doctors from Garbhagudi. One is Dr. Chaitra SK. She is the Assistant Medical Director, Garbhagudi. Dr. Chaitra is a well-known fertility specialist at our Kalyan Nagar and Marathali Center. She has more than 11 years of experience in this field. She has completed her MBBS MS from RGHS and Fellowship in Reproductive Medicine and Endoscopy the same year. She practices obstetrics and gynecology, infertility and endoscopy in Bangalore with high-level skills and knowledge of IVF. She has utmost commitment, care and empathy towards patients. She has amazing success rates. Welcome, Dr. Chaitra.
Thank you.
And we have Dr. Maheshwari. She is our Assistant Medical Director at GGRHR, Garbhagudi Institute of Reproductive Health and Research. She is a Senior Fertility Consultant associated with Garbhagudi at their Hanmantnagar branch. She is recognized for her expertise in advanced infertility treatments and also known for achieving high success rates in IVF. I welcome you both doctors for the show.
Thank you.
And let me start the first question with Dr. Chaitra. Madam, can you explain what IUI is and how common it is?
So IUI is one of the most common fertility procedures which most fertility specialists and obstetricians offer. So it involves the processed semen sample from husband will be inseminated to wife on the day of her ovulation. So this is done in an attempt to increase the chances of pregnancy by increasing the sperm concentration, by increasing its motility and activating the sperms. And it is directly deposited in the upper uterine cavity, that is very close to the fallopian tubes. And while we do this procedure, many times we do a process called ovulation induction or ovarian stimulation. Like the number of eggs also might be a bit more, like 1 or 2 in number, so that this overall increases the chances of pregnancy for a couple. So this is the most common fertility procedure carried out across the world.
Thank you, Doctor. I would like to remind our viewers that May offer is going to expire in another 3 days. Please avail this before it expires. And the offer is we are offering 20% discount on the blood investigations, first free infertility consultation at all our centers in Bangalore. Thank you. Now, my next question would be to Dr. Maheshwari. Madam, how is IUI different from IVF?
So IUI is a simple procedure. So this is the second step of treatment. When they try naturally and if they fail, then we'll go for IUI. And IVF is the third step of treatment. When multiple IUI cycle fails, then we will go for IVF, that is in vitro fertilization. So IUI is a simple procedure. When patient comes on second day or third day of the cycle, we will do the scan and we will evaluate all the basic hormones test and basic hemoglobin, sugars and thyroid, and we'll give medications, oral medications for the egg development. Here we aim to get 1 or 2 good, mostly 1 good follicle. So for the development, if they don't respond for the oral medication, we may have to use very low dose of injections for the follicle develop. So once the follicle develops and it attains a good size of 18 to 20 millimeter, we'll give injection for that follicle to rupture. So around the time of follicular rupture, we process the semen sample and we'll place inside the uterus. This is how the IUI procedure is done. But IVF procedure is a little bit advanced treatment. So there what we do is we aim at developing more follicles as much as possible. So from day 2 onwards itself, we will start with little bit more dose of injections. So 10 to 12 days of injections we will give so that majority of the follicles develops. So once they attain the good size under anesthesia, we take out all the eggs. So and we'll see the quality, how it is, how many is obtained, and for all the mature eggs, we will inject the sperm under microscopic guidance. Majority of the work in IVF will be done in the lab. So after injecting the sperms, we will grow the embryos for 3 days and then we are going to freeze or either transfer in the same cycle. So majority of the procedures are done inside the lab. So whereas in the IUI, here it is a simple procedure where we make the follicle grow. Around the time of ovulation, we place the sperms inside the uterus.
Thank you, madam. I would like to remind our viewers that all our topics of Garbha Sandesha are your recommendations. If you have any further recommendations for which our doctors you wish to talk on, please mention that in our comment box. Now I take the next question to Dr. Chaitra. Madam, why and when is IUI recommended for patients?
So generally it is recommended for male infertility also and also in female infertility. So coming to female infertility, if the patient is having some ovulation problems, we make the patient ovulate with the help of some medications, and then few cycles we will try naturally, and if the patient is not able to conceive with that, then we will suggest them IUI. So most commonly it is recommended for ovulation disorders in female, or it could be also because the patient is having some cervical factors like some infection in the cervix or antibodies in the cervix which is destroying the sperms. So in these two things, and also in endometriosis cases like stage 1 or stage 2 endometriosis, what we call as mild or minimal endometriosis, in these cases IUI is recommended for females. Suppose if we come to male indication, whenever the husband is having slightly subnormal sperm counts or motility, then IUI is recommended so that we enhance this count and motility, because IUI involves processing of the sperms. So when we process, automatically the sperm's concentration is increased, its motility is increased, and we activate the sperms. So in mild male factor subfertility also IUI is recommended. Sometimes for patients with unexplained infertility, like apparently there is no cause found, so maybe such patients will also benefit from IUIs. So coming to combined factors, it could be because of unexplained infertility, and those patients who are not able to keep direct sexual contacts because of some impotency issues or so, even in such patients we can recommend IUIs in order to conceive.
Thank you, madam. Dr. Maheshwari, can you brief me on the causes of infertility that creates a need for an IUI procedure?
So as Dr. Chaitra already explained, what are the indications for IUI? So mainly like when the sperm parameters, if the motility is less and count is little bit less, it is not like very less count, and if very severe abnormalities in the motility, we go for IVF, but if it is a moderate abnormality, we can try IUI. So if the patient has unexplained infertility or mild endometriosis, and with naturally if they are not able to conceive, then we are going for IUI procedures.
Thank you, madam. Dr. Chaitra, could you tell me what is the possibility or symptoms which leads to an IUI recommendation? Is it going to be different from the question which was answered by Dr. Maheshwari?
No, like generally, as I said, we cannot tell, okay, there is specific symptom where the patient can be recommended an IUI treatment. So any patient after trying for 1 year of unprotected sex, if they are not able to conceive, then those patients should definitely meet the fertility specialist, undergo a set of investigations. It is true for both male partner and female partner. They have to undergo a set of investigation, find the cause of infertility, and only if they are suitable to be a candidates of IUI treatment, then only we recommend IUI.
Thank you, madam. I would like to remind our viewers that both our doctors will be happy to answer any questions if you have. Please do post them in our comment box. Dr. Maheshwari, does age influence the possibility of IUI success in a patient?
Yes, definitely age is one of the important factor which influence the success rate of either IUI or IVF. So if a young patient between 25 to 30 years, if they try with IUI, the success rate will be around 15 to 20%. Suppose the same, if it is tried between 30 to 35, definitely there is drastic 2 to 4% reduction in the success rate. So usually from 35 to 40 years, usually the success rate is around 8 to 10%. After 40 years, usually we don't recommend IUI because the success rates are very less.
And one more thing is, even male husband's age is also equally important when it comes to choosing for IUI. Because as male is aging also, there will be problems in the semen parameters, the abnormality of the sperms also increase. So generally again, when it comes to male beyond 40, we don't recommend IUI treatments for such men also.
Thank you for that added information, doctor. Next question would be to you, Dr. Chaitra. Are there any possible complications of reproductive health when IUI is not performed at the right time?
If for right time, in the sense going by age of the patient and all, see, first of all, any fertility treatment has to be offered at the right age at the right time. So what we are insisting is that any couple after marrying for like 1 year of 1 year of natural try, if they are not able to conceive, they have to meet fertility specialist and get the treatment done, like whatever it could be. It could be a simple treatment or an IUI or an IVF. So what happens is most patients continue to try naturally for a very long time. They continue with the simple ovulation induction, again natural try for another few more years and all. And when they actually come to us, they will not be the right candidates for IUI treatment. So they think that next immediate treatment will be IUI, so we should offer IUI. It all depends on the patient's age, their infertility factors, what is the semen parameters, and then only we can suggest whether they are a suitable candidates for IUI or something higher treatment has to be offered. So we should not be under the impression that after natural try it is IUI. It is not like that. So it is important that IUI is offered to a right couple going by their age, their infertility factors, their duration of marriage, and other treatment history what they have taken in the past.
Thank you for that comprehensive reply, madam. Dr. Maheshwari, is there any connection between patients' lifestyle habits and IUI success?
Yeah, definitely the lifestyle contributes a major chunk for the infertility causes and all. So especially the smoking, if they're smoking, even in females, in the males also, there is increase in certain toxic chemicals which affects in the males the sperm parameters, the count, motility, and it causes breakages in the DNA. Even in the females, it can affect the oocyte quality and it can reduce the number of oocytes. And also the alcohol also affects both the fertility issues in the males and females. Even the obesity, sedentary lifestyles, and their eating habits, like taking too much of outside food, like which has lot of preservatives, chemicals, colorants and all, definitely they are going to affect the fertility health of both males and females. So especially in the males, if we consider like increased exposure to radiations, increased exposure to heat, like those who work in a like environment like where they use cooking and all, or where the in the with their occupations, like if they work in industries where the temperature is more, that is going to affect their count, motility, as well as the DNA fragmentation index. So if all the parameters are affected, so definitely the success rate of IUI is going to reduce with these factors. So in this patient, the best part is with slight modification of their lifestyle factors, the few things can be reversed.
Thank you, madam. Dr. Chaitra, can you discuss common myths about IUI?
So that I was speaking, like IUI is the first line of treatment for any fertility couple after trying naturally, that IUI will be the first line of treatment. So that is one common myth. And anytime when IUI is performed, there is chance of 100% success. This is another common thing what they perceive, the patients think. And twins, triplet rates are very high, they think. That is also not true. The twins and triplet, the multiple organ pregnancy is quite less. It's hardly about 5 to 10% only. Then there is another thing is that patients will think that after trying 1 or 2 cycles of cycles of IUI, if things are not working out, they have to immediately jump for higher treatment. So generally any IVF center would recommend at least 3 to 4 cycles of IUI before concluding that this treatment may not work for them. And when coming to complications, it's important that IUI is done at a right place, so that unnecessary complications like ovarian hyperstimulation syndrome or infection chances are drastically reduced if you are doing it under right guidance.
And also in few cases we have seen the processing of the semen sample, it will be done in the lab. The person, that husband, will carry the processed semen sample for another 30-40 minutes to the center. In a different center, the semen will be inseminated. Okay. By doing all these things, the quality of the sperms will definitely reduce, and also the success rate will also reduce. So always it is better to process the semen sample in the same center and do the IUI in the same center.
And that's also true that at any age, at any given infertility factor, they perceive that IUI works for them. So most of many patients of us, after trying naturally, they come and directly ask for IUI treatment, thinking that it is the next line of treatment and is definitely going to offer them best success rates. So IUI is a treatment which is actually not recommended for all. There is only a subset of patients whom we have to choose after their evaluations and then decide whether they are the right couples. And only when we do this right selection, then only we can give a success rates of 20-25%, and it is never beyond that.
And also few as like patients with very bad semen parameters like 2 million sperm count, 1 million sperm count, and also if their egg count will be 2 or 3 like that, AMH will also be very less. In those patients, they'll come and they'll start insisting only for IUI treatment because they have not taken treatment. Now no treatment has been taken till now. So those things, it is better you take the advice from the specialist and then proceed for those kind of treatment.
Thank you for busting those myths and recommendations. Thank you both, doctor. We have a question from a viewer. The viewer name is Shubha Biradar. She is asking me, please tell me about laparoscopy and when laparoscopy is required. This question I would cast to Dr. Chaitra and later to Dr. Maheshwari madam, if you want to add anything.
So suppose if the patient has come for an evaluation for infertility, definitely there will be some patients who will require laparoscopy treatment. So who are these patients? So first we see whether on first visit itself we do a transvaginal ultrasound and decide whether this patient requires a laparoscopy. So if the patient is having something called fibroid uterus or an endometriosis of the ovaries, or sometimes inside the uterine cavity there might be something called endometrial polyps, and patient might also be having something called polycystic ovarian syndrome. So if these things, if we see on a scan, and if the patient is having long-standing infertility, we don't find any other cause, then we have to come to conclusion that probably this is the reason why the patient is having infertility. So in such patients, we do recommend laparoscopy. So if it's a fibroid which is actually affecting her chances of pregnancy, myomectomy will be done. If it is endometriosis, we remove the endometriosis from the ovaries. If it is a polyp inside the uterus, that will be removed. And if the patient is having polycystic ovaries, she is not responding to ovulation properly, the patient is repeatedly having treatment failures, she is having too much of hormonal imbalance, then we do polycystic ovarian drilling through laparoscopy. And again, there might be many patients who have undergone tube tests through an X-ray called an HSG test. So if we find some tubal blocks or any collections in the tube, then laparoscopy will be done to open these tubes or remove the tubes depending upon how badly the tubes are affected. So these are the patients who, and there are some patients also who have some abnormalities of the uterus. So it could be developmental abnormalities we call as septate uterus, or sometimes bicornuate uterus and all. So these patients will require laparoscopic evaluations and correction in the same sitting, and then we proceed to an IUI or IVF treatment depending upon other infertility factors.
Ms. Biradar, I think your question has been answered. I would like to remind our viewers that you can get your answers in Kannada or Bengali. Our Dr. Maheshwari can speak in Bengali. If you need your answers in any of these two languages, please mention it in the comment box. Now, moving on to the next question. How does IUI impact chances of conception? Dr. Maheshwari.
See, IUI, the overall procedure success rate is, it varies from 10 to 20%. So the success rate depends upon the age, whether the fallopian tubes are open or not, how is the uterus, and the number of follicles, and how good the follicle has come, and the endometrial thickness, and also husband's semen parameters, and also wife, what is her weight, and any other medical problems like thyroid, uncontrolled diabetes, or hypertension like that. So on an average, around 10 to 20% will be the success rate. So we cannot say if we try IUI in first attempt, like results will be obtained. So at least 3 to 4 cycles of attempt we have to give for the IUI. If it is not successful, then only we will go for IVF treatment. It depends upon the multiple factors.
Thank you, madam. Dr. Chaitra, when is the best timing for an IUI, and how does timing impact the probability of IUI success?
As I told that any IUI procedure, the female partner will be generally made to give some medications called ovulation induction. So we start the follicular monitoring, and the patient should respond in such a way that generally between day 12, day 16, we should be able to complete the IUI process. So that means that her the egg quality and all might be good enough. And other thing is that most commonly most fertility specialists do a single insemination IUI, so that we plan after the ovulation. So we give something called a trigger shot once the egg is ready. So once this trigger shot is administered, generally ovulation happens 36 to 38 hours later. So we call the patient to hospital about 36-38 hours later, document the ovulation, and then only start the semen processing of husband. So if at all, if the patient has not ovulated, then it's better to wait for few more hours, document the ovulation, and then start the IUI processing. So it's important that IUI is done soon after ovulation, because we have to understand that the egg, once it is released into the body, it will be alive hardly for about 12 hours. So it's important that IUI is performed soon after ovulation, so that the sperm will be able to meet the egg before this 12 hours, so that it gets fertilized and leads to pregnancy.
Thank you, Doctor. Dr. Maheshwari, how many IUIs should each patient try before going to IVF?
So for a young patient who is between 21 to 28 years or 30 years with good reserve, with normal semen parameters, her tubes are good, her uterus is good, no other problems, her AMH is also normal. Ideally, as recommended, 6 cycles of IUI we will try. So if the patient's age is more than 30 years or 35 years and AMH is less and also AFC is less and also husband semen parameters are bit abnormal, in those cases maximum 3 cycles of trial we will give.
And there are many studies which are telling that most pregnancy, about 70% of pregnancies happen in the first 2 cycles itself, and about 80-82% will happen in the first 4 cycles. So if the patient is not able to conceive by 4 cycles, generally it is not wise to proceed with the 5th cycle. It's best to go ahead with the IVF treatment.
Thank you for that additional information, Dr. Chaitra. The next question is coming to you. How long after IUI should implantation occur, and when will patients know they have been successful?
So after IUI, we generally give some progesterone medications to the patient, so that the pregnancy is supported. So once the IUI is performed, we do the pregnancy test by urine test first, about 16 to 18 days later, and if she tests positive, it will be further confirmed with the blood test and subsequently scan.
Thank you, Doctor. I would like to remind our viewers that we have just another 3 days for the May offer to expire. Please visit any of our centers in Bangalore and avail the offer. 20% discount on blood investigations, first free infertility consultation. Dr. Maheshwari, how long before an IUI should the males abstain from intercourse, ejaculating, and store up sperm?
See, ideally what we tell is when we are doing the IUI stimulation, so at least alternate days we'll ask them to have a natural intercourse, because whatever the sperms were deposited in the vaginal crypts, so usually it stays for 2 to 3 days. It will be alive sperms, and the chances of IUI success rate will be little bit more. So what we recommend is 1 day of abstinence before the IUI. At least 1 day gap should be there before giving the sample for IUI.
Thank you, madam. Dr. Maheshwari, there is a question. The sender has not mentioned the name. The question is, what are the success rate if PCOS patient want to take IUI treatment?
See, in a PCO patients, usually they'll have more number of eggs, and also their AMH value will be more, and their baseline LH value will be more. So this kind of patients require longer duration of treatment. Usually they don't respond like a normal people. So we may have to give more days of injections, more days of medications. Sometimes what happens, instead of 1 follicle, 3 or 4 follicles might develop. If there is any chances of if more follicle develops, hyperstimulation happens, we will cancel the IUI cycle. If only 1 follicle or 2 follicle develops, we can do the IUI. So the overall success rate is around 10 to 20% as normal. Only thing is they require more days of stimulation and PCO.
Thank you, madam. Dr. Chaitra, what is the success rate of IUI and what are the factors that determine IUI success?
So as I said, generally the worldwide IUI success rates are between 18 to 20%. And as we discussed till now, the first main important thing is the age of the mother. So if the age of the mother is less than 35, we can offer better success rates. Age of the father is less than 40, better success rates. And when it comes to duration of infertility, lower the duration of infertility, like if the married life is less than 4 years or so, we can see that by studies best success rates are there. And there are certain semen parameters, like whenever a patient does their semen analysis, they can assess in that only that in case if this patient undergoes an IUI treatment, what could be their success rates. So at least pre-wash in the analysis report, the sperm count should be at least 10 million. And after processing of the sperm, the patient should be able to get at least 5 million of motile sperm count. So if they are able to get this 5 million motile sperm count post semen processing, then definitely the IUI success rates are better in these patients. And if both the tubes are patent, laparoscopically we have seen that the tubes are very healthy, so that again increases the chances of IUI success rates. And while we do all these things, the patient's comorbidities also should be identified and corrected. Like if patient is having any hormonal disorders like thyroid or prolactin, it has to be corrected. And good progesterone support also has to be given after IUI. So if we are keeping and right medication administration, right monitoring, right time the ovulation trigger should be given. And always IUI should be performed at a place where you are undergoing the ovarian stimulation and also with the same fertility specialist. The sample should be processed in the same clinic and inseminated there itself. So you should make sure that there is no delay. Soon after ovulation, IUI should be performed, and soon after the semen processing is done, the sample has to be inseminated to the patient. So you have to keep all these things in mind, and then only the IUI success rates can be maximized. Doing processing elsewhere, doing the analysis somewhere, doing insemination somewhere, and not properly monitoring through ultrasounds, then delaying the IUI process after several hours of ovulation and all will definitely hamper the success rates. And this is the reason why the lower centers will have very low success rates. Why we always insist that IUI treatment or any fertility treatment should be always taken in a fertility center under the guidance of fertility specialists, because these minor things which can actually make a major difference to the IUI success rates will be taken care well in an IVF center.
Thank you, madam. Very comprehensively explained. We come to the last question of today's episode. Dr. Maheshwari, is there any advice you would like to give the patients undergoing IUI?
See, during IUI stimulation, whatever the medications is recommended, that has to be followed properly. And also whatever the tests which are advised, like hemoglobin, sugar, thyroid, everything has to be checked. And also if the tubal evaluation is not done, it is better not to force the doctor to try for the IUI without doing the tubal evaluation. And also one more thing is when the semen parameters are very bad, still they keep on insisting that the IUI has to be done. So that has to be stopped. Like whatever the doctor advises, it is better to listen to that. So they are the best person to guide whether IUI is best or IVF is best. Depending upon that, they have to follow the treatment properly. And also after IUI, they can have a normal life. There is no thing like a complete bed rest which is required, or they'll have some misconception that so complete bed rest will increase the results. All those things has to be avoided.
Thank you, madam. Dr. Maheshwari has turned out to be the myth buster of this evening. With that, we come to the close of talk. But before we conclude, I would like to take the final recommendations or conclusions from both our doctors. Dr. Chaitra, please go first.
So first thing is that don't be under the impression that IUI is the treatment of choice as soon as there is an infertility. So never force your fertility specialist just to try some IUIs because it's a cheaper alternative to a IVF treatment. Always go through a proper evaluation, listen to your fertility specialist, understand your cause of infertility and whether IUI is the right treatment for you, whether it can offer you the best success rates and whether it is worth trying. And only then IUI should be undertaken. If you are a candidate for IVF, that again is based on your fertility test results, then you should not hesitate to undergo an IVF treatment. We have to understand that IUI is not meant for all infertility causes.
Dr. Maheshwari, would you like to add something?
So IUI is the intermediate treatment between trying naturally and the IVF. There are certain indications where we have to do if we do the IUI, the success rate will be good. There are certain conditions like when the tubes are very badly affected, if they are blocked, or if the tube is diseased, or if the husband semen parameters are very bad. So in those cases, it will not give results. So instead of trying if the conditions are there, instead of wasting time trying the same thing, like in peripheries, what they do, they keep on doing the IUIs without evaluating the tubes, whether it is normal or not. So always better get the test done properly and take the treatment in a proper IVF center and get a good success rate as early as possible.
Thank you. With that closing talk, we conclude this particular Garbha Sandesha of 25. Please send in your questions and your recommendations on further topics. Thank you. Thank you, doctors.
Thank you.